So this morning I'll try to describe a little bit different approach that we're taking to doing non-invasive neuromodulation using focused ultrasound as one of the components. So we know that the goal of neuromodulation is to affect the activity of neurons in some controlled manner. But there are two components to how neurons pass information in the brain. The first is an electrical component where an action potential travels down the axon of a neuron, but there's another component that's a chemical component that happens at the synapse between two neurons where a neurotransmitter such as GABA or glutamate or dopamine is released to pass on a signal to either excite or inhibit the action potential firing of the following neuron. And so most neuromodulation techniques target this electrical component. Certainly it's thought that the Foos method does, and other techniques such as optogenetics or transcranial magnetic stimulation do. But our goal is to target the chemical component, and the way we propose to do this is through BBB opening, where we're going to selectively open the blood-brain barrier using Foos, and then just do a systemic injection of our neurotransmitter such that it diffuses into the synapse and has an effect that way. Okay, so the study was done in rats, and we're going to try to elicit activation by doing hind paw stimulation. So those stimulation parameters you see there are the electrical stimulation parameters, not Foos. And we expect activation in S1, and we're doing both hind paws so to get bilateral activation. And then, as I said, we're going to do just a simple bolus injection of GABA in the tail vein. And then for the BBB opening, we're only going to do that unilaterally so that we have the other side as a kind of internal control that we hypothesize would not be affected. So to measure the effects, we're using functional MRI as a way to get a measurement over the entire brain that should show us both the spatial location and the intensity of the activation that's correlated with our hind paw stimulation. And we're also using an anesthesia dextromethor, a constant infusion that should keep the rat in a lightly anesthetized state. So we approach this with a 2x2 design where we're going to look at factors of BBB closed versus BBB open, and then no GABA injected versus GABA injected. So these are sort of the baseline control results. This is over group averaging over 6 rats, where we see good and pretty consistent bilateral activation where we'd expect it in the somatosensory cortex. And then the first question is, when the BBB is closed and we're just injecting GABA, does that somehow have an effect? And at least initial results suggest that when the BBB is closed, systemic injection of GABA does not. These are some T-score metrics that over these first 6 rats at least don't show any significant differences either between the two hemispheres or between the two cases of GABA versus no GABA. Okay, now we just have some preliminary results over 2 rats for the BBB open case, so I'll show them individually. This is the first example where you see the gadolinium enhancement of the BBB open in the bottom corner there. And in this case, when there was, before we injected GABA and we did our fMRI run, we still see bilateral activation. And then on that same rat, just about 20 minutes later, we do a bolus injection of GABA, and we're now seeing a little bit of suppression on that side where the BBB opening happened. And again, an evaluation of T-scores. We don't have statistics yet, but you can see a much bigger difference in the activation between the two sides. And then another similar result on a second rat. In the top, before GABA is injected, we get roughly equal activation on both sides. And then on the side where we did the BBB opening, we see some suppression. And I should have said that this is what we hypothesize as GABA is a neuroinhibitor. And again, these are the T-score metrics. Okay, so just to wrap up, we don't think that GABA injected alone is having an effect, but then when we do open the BBB, I didn't show these results, but if we use too high of power, we do see suppression even without GABA, but now we think we've titrated the power enough to get opening, but not suppression of activity. But then when we do inject the GABA, at least we're seeing some initial promising results that suggest it may be having an effect, but we want to do more animals to confirm this. So thanks to everyone in the group who helped, and thank you.